And joining us now is Dr. Shreya Khangovi, an internist and executive director of the Penn Center for Community Health Workers, and NBC News medical correspondent Dr. John Torres joining us as well. Dr. Khangovi, what are you learning in your research about how to get this under control? Because the message that we're beginning to pick up from the reporting from Dr. Fauci yesterday is it's out of control, and all the hard work of the first 4 months may be for naught.
Yeah, Andrea, first of all, thank you so much for having me. I think what has made this so challenging is that containing the virus is really wrapped up, as we've just heard, in all of the daily realities that Americans face, right? So let's say, for example, you're Sam, you're a laundry worker from North Florida where COVID is surging faster now than ever. And you get a call saying that you've been exposed and need to quarantine. And yet you're thinking, who's going to explain this to my boss? How am I going to put food on the table? Who's going to pay my rent? And unfortunately, a lot of the containment approaches that we're seeing, whether it's smartphone apps or call centers with contact tracers, they may not take those realities into account. And so there's a risk, actually, that we have solutions, public health solutions out there that are designed by and for privileged people. And so some of our research really points to what we really need, and especially these hardest hit communities, is to incorporate community health workers. These are local boots on the ground. They're trusted individuals from within local communities, and they actually tackle those daily realities. So they're advocating with Sam's boss. They're dropping food off on his porch. They're helping him battle that eviction notice. And there's a strong body of scientific evidence that shows that community health workers can improve health, and they can actually prevent hospitalizations, which saves Medicaid about $4,200 per beneficiary. So, especially at a time where we're hearing that medical bills are swelling, pouring in hospital, not only because of COVID, but all of the chronic diseases that have been building up through the past several months, this workforce can actually help save U.S. taxpayers billions of dollars per year.
And one of the things that certainly came to the fore in the hearing with Dr. Fauci yesterday, Dr. Torres, is face coverings, masks, and there are different levels of masks. We now know what is more effective. Why don't you help our viewers understand what is the best kind of mask to wear?
So what we're finding out are the best kinds of masks to wear are the ones that have more layers, especially the cotton ones that have multiple layers, because they can help filter it out. And there's a difference between wearing a mask if you're coughing or sneezing and wearing a mask if you're not sick or don't have any symptoms and are simply talking. In a case like that, any type of face covering certainly could go a long way towards helping this out. But one word of caution here is the mask in and of itself cannot give you that sense of security that you don't need to social distance. You need to do these things arm in arm. Social distancing, wearing masks, not being in large groups, those are the things that are going to help get this under control. But wearing a mask in general, it's not 100% effective. No mask will be that effective, but it does give you some protection that you would have without the mask. And more importantly, it gives other people around you protection. And like Kerry Sanders was saying, we're seeing a lot of young people that are getting this thinking, well, it's not that big of an issue because I'm young, we don't have the complications. Well, we're finding out they're having more complications than we thought they were. Plus, an even bigger issue is they can take this and spread this to other people, especially those that are most vulnerable. And none of them would want to do this, but this is what we're seeing happening across the country. And like the doctor was saying before me, one of the big issues, especially in different parts of the country, are those essential workers that can't get out of the areas that they have to do working. So they might be exposed to it there. They might have to do that. And one of the things, I've talked to experts from the American Indian tribes, I've talked to experts from the Latino community, and they're saying contact tracing with them is a big issue because of trust and who they can trust when they get that phone call. So if they don't have community members giving them that phone call, if it's others outside the community, they're simply not going to tell them the truth. And that's what I've been told over and over again.
And certainly in the undocumented community, nobody is going to trust anybody with the crackdown that we've been experiencing in the last couple of years as well. Dr. Khangovi, in some of these communities, if there isn't enough testing, contact tracing is not going to be as effective even if you had the professionals to do the tracing.
Yeah, absolutely. I mean, I think that there is, a multifaceted approach that we need, that we've always talked about, certainly effective tracing. And, again, it's not just enough tracing. You have to support people with all of the daily realities that surround them, the social, economic, behavior change reality that actually help them quarantine, that help them to address not only COVID, but all of these other health issues that are happening right now in our communities. But you absolutely need to have testing, and the testing needs to be done in ways that are equitable. You know, we just saw a clip where cars were lined up, and a lot of testing is being done through your motor vehicle. A lot of people don't have a car. So you need to have, you know, again, we have to be designing these solutions with folks like Sam in mind. If we have solutions that are designed by and for privileged folks, this pandemic is going to continue to rage in some of the hardest communities. It will spread throughout the rest of the country. Our economy will still stutter, and then we will have all of the health effects from actually having a faltering economy.
Dr. Kangovy, thank you so much. Dr. Torres, as always, it's great to see you. Thanks for your help today.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.